So this video talks about self-care in heart failure. The objectives of the presentation are to bring you some of the information from the Heart Failure National Guidelines regarding the recommendations and self-care, to talk a little bit about some of the factors that influence self-care, and then to mention some of the practical tips that you may be able to apply when coaching and supporting patients with self-care behaviors. So this slide really talks about why self-care is important, and I think there's two key points. One of them is the majority of their time they are out there making those decisions, figuring out what's best to do. They don't have a healthcare provider beside them at that time. 98% of their time is spent without a healthcare provider nearby. So really helping them build that skill set for those times. The other thing is, as much as healthcare can be difficult, it actually helps improve quality of life. It helps people stay out of the hospital, and some studies show it helps them live longer. We want to encourage them to lead an active life, feel good, and engaging in self-care certainly supports that. And there's evidence from this article that you're welcome to reference. It's a wonderful overview. So on the next slide, we talk about what is self-care. And really, self-care is a process of working through some of the instructions, making decisions that help you feel better. There are day-to-day decisions, and then there are also some decisions that you make when things change in the setting of a chronic disease. It's mainly pictured in heart failure it's mainly described in heart failure as three main areas. We talk about self-care maintenance, self-care monitoring, and then self-care management. When you think of self-care in heart failure, we often describe it in three main components, but it talks to healthy behaviors, but also managing their chronic condition. One of those components is self-care maintenance, then we get into self-care monitoring or symptom monitoring, and then self-care management. You can see on this slide there's a visual of these three major components. From a patient's point of view, when you think of self-care maintenance, it's about what are those activities that I need to do day to day to help keep me healthy. Symptom monitoring is about what are my symptoms of heart failure and how do I know if they are stable or changing. And then the last one is about symptom management. If there is a change, what is the action plan that I need to do to help get those symptoms back under control? So the next slide is an overview of some of the activities that are involved in self-care maintenance in the setting of heart failure. As you can see, there's managing medications, there's about making sure you're not smoking, which is part of the risk factors. There's looking at dietary changes, which is sodium and fluid restriction. There's looking about daily exercise and staying active. And then also we're getting into a little bit of symptom monitoring with daily weights. So over the next few slides, we'll look at these in a little bit more detail. This slide presents the recommendations from the guidelines about exercise, but really what I want to encourage is that if people can stay active, it's one of the best things they can do for their heart and their general health. Often patients with heart failure will say they just don't have the energy or stamina to engage in regular exercise. So coaching them is more about what is meaningful, what is reasonable, what do they enjoy as far as some physical activity and some exercise. It may be a couple laps down the hallway, a couple times a day. It may be joining a Tai Chi class. It may be involved in cardiac rehab. Whatever it is, try and encourage them to engage in physical activity and some exercise, but work with them to figure out what that would look like for them and how we can work through some of those barriers if they see it being rather difficult. The next slide talks a little bit about sodium and fluid restriction. This is very difficult for patients, and I can fully understand because when you add salt, things taste a lot better. And so trying to be reasonable. And the point of this slide actually is to show you that the national guidelines have actually softened these recommendations. There isn't a lot of evidence to support sodium and fluid restriction in everybody. What you want is people with high blood pressure. Definitely sodium restriction is very important. There are some people that are sodium sensitive, where they find they have some food that has some extra sodium, whether it's a ham or out at a restaurant or some pizza, and they notice the next day they're up a few pounds. Absolutely, they are salt sensitive. Not everybody is, and so you really need to be aware that this needs to be individualized from patient to patient. Same with fluid restriction. Agree that we don't want them drinking a lot of fluid and then taking a lot of diuretics. But if their diuretic dose is reasonable, they're not filling up with fluid, whatever they're drinking in the fluid amount is probably fine. In the setting though where they're hyponatremic, definitely fluid restriction. We do have to be a little bit more stringent on those situations. The next slide talks about the medication management. And as you know, people with heart failure have to take a lot of medications. There are three main things I want to point out to help patients with self-care and managing their medications. The first one is just recognizing that it is difficult. Sometimes I'll even say, wow, you do take a lot of medications. How do you organize that? How do you make sure you can take them as prescribed? That must be very difficult. Do you have a system that works for you? And talk about that versus just assuming that they are taking their medications as prescribed. The next one is those diuretics and those darn water pills and some of the side effects. As you can see here in the quote, this woman was really shamed over what happened to her. If you ask her to continue to take medications and her diuretics in the morning, she's not going to do that. She's not going to go through that experience. And self-care is learned over time and does build from experience. This experience has told her taking medications or taking diuretics doesn't work for her. So we got to figure out another plan. Is it taking it later in the day? Is it taking some extra one day and you get a diuretic holiday on another day that you know you're going to be busy? Whatever works for that patient, try and be creative and problem solve. The last one is dealing with those side effects when you're trying to optimize some of those medications for triple therapy in the setting where their blood pressure may not be really high, and yet they need those ACE inhibitors and beta blockers because it helps improve their outcomes for heart failure. So these are some tips on looking at scheduling the medications to avoid that symptomatic hypotension, or maybe that afternoon fatigue where they take their beta blockers in the morning and they're exhausted by the afternoon. So these are just some tips to keep in mind when working with patients and trying to optimize those medications and minimize some of those side effects. The last slide for self-maintenance talks about daily weight, recognizing that if they can check their weight first thing in the morning, look to see if there's any sudden changes, that is it fluid starting to accumulate, or actually are you starting to lose too much fluid? Regardless, it's a good check, just like diabetics have to check their sugar. People with heart failure, if you can check your weight each day, that is very, very helpful. Some people may not own a scale. Some people may own a scale but can't see the numbers. So we need to be creative at working through some alternative solutions when checking their daily weight may not work so well for them. And that's really starting to pull out some of their other symptoms that they may be able to pick up on when the fluid level is changing. When it comes to symptom monitoring, I think this is where we can really help patients try and identify their early symptoms of heart failure. Often patients wait 5 to 7 days before they seek assistance, and some of it is just not picking up on those subtle changes. Patients have a hard time with this, but if we work through with them, ask them to tell their story. So tell me what happened in those couple days before you came to the hospital. Certainly helps. What you will find is that symptoms may vary between patients. Someone may get swelling, somebody doesn't. Someone may notice their rings are tight, somebody else they develop a cough. But what I do find is that the symptom pattern within patients is similar. So helping them recognize their symptom pattern and what to do about it is really helpful. We had someone that said, I know when my mom is starting to develop symptoms of heart failure because she sounds foofy. And when she sounds foofy, I know her ankles are going to swell over the next couple of days. So we need to start when she gets foofy. I'm sure foofy is not in a book about early symptoms of heart failure, but that's very meaningful for them. It's subtle, it's early, and that's what we need to encourage our patients to figure out. So that brings us to the next slide, which really is an overview of helping them work through, do they notice their symptom? What are they going to do about it? And developing that action plan and working through some of those decisions. As you can see, it is a problem-solving process, and it's really helping them identify the problem. Uh-oh, my symptoms have changed. What do I need to do about it? And then action plan, you really need to work through with them. And so it is a series of questions that they need to start thinking about themselves. Sometimes I find patients do have difficulty with working through that action plan, and so you need to really spell that out very clearly, what's reasonable, simply, and so they know what's ahead for them in certain situations. On the next slide, you can see here's an example of the stoplight that has been commonly used for helping people identify what zone they're in as far as their symptoms. So if they're in the green zone, they've done a check, their weight's okay, their symptoms are fine, perhaps it's their rings, perhaps it's their swelling, perhaps it's their breathing, their energy level, their sleeping at night, whatever it is that's part of their check. They don't have any of those early signs, then they are in the green zone and they've got an action plan. As providers, helping them identify what their green zone looks like versus this is a typical green zone, they need to know what is their green zone. Then the yellow zone, when they're starting to run into trouble. It's not an emergency, but the idea of trying to do something at that stage so that they don't develop into the red zone where now they're in trouble. So coming up with a reasonable action plan. So what is their yellow zone? Is their yellow zone simply adjusting their diuretics because they feel comfortable with that? Is it giving you a call? Just to wonder to go through some of those ideas on how they're feeling, problem solve with them to come up with a plan. Some people are very good at working through that yellow zone and don't need to call, and I find the experts can do that more comfortably, but it is learned over time, and so often you need to support patients through that learning period at the beginning. The next slide is really highlighting that self-care isn't easy. It is a skill. It's not just knowledge. Sometimes I use the example of learning how to play golf. So just giving someone a book and have them read about playing golf, that's not going to help them play golf. They really have to go out there, play golf, play it a couple times, swing that club, have those mulligan shots where things don't go so well, but learn from them. And it really is a process of learning over time. And so just appreciating that it is difficult, but trying to move forward through that coaching. Even when you're coaching someone in a skill, it takes them time as well. So recognizing that reinforcement is needed, encouragement is needed, there are going to be bad days, but how do we work through them? And recognizing that the caregivers are also a wonderful support for them. So it's not easy, but keep working through. The next slide is actually, I really like this diagram. It speaks a lot to the complexity of self-care. There are many things that affect their self-care, whether it's how they're feeling that day, whether their support system around them, whether what's available to them in their social circle. And so the purpose of this slide is really to recognize that decision-making and self-care needs to take in a number of factors that you work through with your patients. This article provides a wonderful summary and some great background, but it's not as simple as I know what to do and I'm going to do it. Many different things will impact that. And sometimes you just need to work through some of those variables before self-care can move forward. On this slide, you will see the parallels between providers learning and patients learning. So providers are learning about the guidelines, but they want case studies on how do I apply that in my clinical practice. Patients are very similar. They're learning as well. So we can provide that information, but they want examples. Well, how do I implement this into my day-to-day life? How do I plan ahead for some of those activities, whether it's holidays or travel, things out of the ordinary? They need need support through working through some of those examples versus just giving them the information on what they need to do. They need help on how to implement that into their life. Although supporting patients with their self-care is really important, I think we have to be really mindful that caregivers really are the unsung heroes. They really help support patients. And sometimes we need to support the caregivers at helping them learn, and because they may be the ones that are doing a lot of these activities to support the patient. But just being mindful that caregiver burden can creep in, and we have to be sensitive to that and keep that on our radar. It really is a partnership agreement, and I don't want to lose sight of the fact that caregivers are really, really important and a really helpful member of the team. In summary, self-care can be difficult, but at the end of the day, it does really help improve quality of life and the symptoms of heart failure. And it's really learning over time, coaching. There'll be good times, there'll be difficult times, but working through that process and that reinforcement. I remember someone said to me, "No one ever told me about low sodium." I said, "I'm sure that nobody was me, because they've been coming to the clinic and talking with them for over 3 years." And I think it really speaks to the fact that reinforcement is important. The cognitive function isn't as great in people with heart failure than some people without heart failure, and so don't be surprised if you do need that reinforcement. The final slide has some examples of some education materials that you can find online. There's a patient website for advocacy that was developed in Canada. The European website actually offers information in a number of languages. If you click on that language, the whole website converts to that language and is very helpful. There is also information there, or the website, for the little booklet for healthcare providers. Some of the information that we covered in this talk today is also provided in that pocketbook, and you can get that from the Core Health Ontario website. So this concludes the video, and thank you for your attention. If you have any questions, please feel free to reach out to us at Core Health Ontario.